Case study time. Here we go. Patient is a 35-year-old male with neck pain, especially on rotation. He actually came in having visible cupping marks on his neck. He has trouble falling asleep, especially at 11 o'clock p.m. He's had chronic gut health issues for about 10 years now. He's occasionally getting temporal headaches, so your temples, and he's got pain in the thoracolumbar area. Let me show you that. The thoracic spine consists of 12 individual vertebrae. The lumbar spine consists of 5 individual vertebrae. The transition area between both of them, which is at T12L1, is what we call the thoracolumbar area. This is important for a number of reasons, which I'm about to show you. First off, I want to show you this particular line right here going through this person's body. This is what's known as the Gall Bladder meridian in Chinese medicine, or what's typically known as acupuncture. This is especially important because the patient noted in their history that he's been having pain around his temple area, where a lot of activity from the meridian itself surrounds. He also noted that he had been having trouble falling asleep around 11 p.m., which happens to be the gallbladder time. This is where the story starts developing more. The gallbladder is this little tiny organ that lies underneath the liver, and its main function is to store and concentrate bile made from the liver. Bile is essential for digesting fats in the small intestine. So when food, especially fatty food, enters the small intestine, the gallbladder releases stored bile to actually help break down and absorb these fats. These are what are called associated points, so points that we would actually use to adjust or treat based upon an applied kinesiology muscle testing analysis. And as we see at T10, T11 transverse processes is where the gallbladder is most affected. So just above the level of that transitional area of the thoracolumbar spine that we talked about. As part of diagnostic criteria, in Chinese medicine, as well as applied kinesiology, and in the technique known as neuro-emotional technique, or NET, we use individualized radial pulse points to determine what's called the most deficient or most active meridian at that time. As we see, the middle pulse point on the left wrist, which is known as the wood element, contains the gallbladder. This becomes especially important because the main master chart relationship between the gallbladder is the concept of resentment, which this patient did have when we actually went into the analysis using neuro-emotional technique. With using these various methods of applied kinesiology and neuro-emotional technique, we had an understanding about what was actually causing some of the issues that had been happening in that transitional area of the thoracolumbar junction. The patient later revealed when we did neuro-emotional technique that he had been dealing with a certain resentment issue with a family member, and that was causing him to have these subconscious thoughts that he said were typically harboring around that 11 p.m. period when he was trying to fall asleep. So essentially what we noticed is that the excess amount of qi or energy had been stuck in that gallbladder point area and was prohibiting it from actually going around in a natural 24-hour clock cycle. We also tested various remedies, one from NET, which is the wood element that actually helped out with the processing of the emotion that he had had with resentment, and we had checked some muscle function, especially what's called the popliteus muscle, for his gallbladder. Every organ has a muscle correlation. In this case, the gallbladder relates to this little muscle on the back of the knee right here called the popliteus. The function is that basically on heel strike, the muscle contracts to actually unlock the knee to absorb shock. You'll often see a lot of patients who come in with pain as they walk downstairs or downhill, that they have a tough time with that heel strike to actually help with the stability of the knee. Fortunately enough for us, after we did these treatments with this patient reported to feel a lot better. We're going to follow up next week to see actually what's going on regarding his thoracolumbar junction, as well as some knee pain that he had, and let's see if the sleep issues improve. So I hope you enjoyed this little case study from a holistic weirdo perspective.